So you're a health-conscious individual who wants to take control of your well-being, but you're struggling with confusing cholesterol numbers. Maybe you're experiencing frustration over conflicting advice about what's truly healthy and concern about being pushed into taking unnecessary medications. Maybe you want to understand how to naturally balance your cholesterol and take control of your overall health. Well, in today's video, I'm going to help you to uncover the truth about cholesterol and inflammation so that you can experience better health and more clarity in your wellness journey. Welcome back to my channel where I help you decode your blood work so you can manage dis-ease from a root cause perspective. My name is Dr. Arts. Let's get started. First, let's debunk the myth of good versus bad cholesterol. Cholesterol is required for a few main functions in the body, one of which is to produce steroid hormones, which include sex hormones like testosterone, progesterone, and estrogen, as well as a very important adrenal hormone called cortisol. We also need cholesterol to help repair the damage done by inflammation and oxidation. These things can happen for a variety of reasons. Most of my patients are struggling with inflammation due to autoimmunity, but we can experience an inflammatory process due to elevated blood sugars, as well as food sensitivities and environmental toxins. We also need cholesterol to produce energy in our cells. That's why a lot of patients who go on statin medications will experience fatigue and muscle cramping. So if cholesterol is so important, why is it always labeled as bad? Why do lab reference ranges tell us that the lower our cholesterol is, the better? Newsflash, if you didn't have any cholesterol, you wouldn't be alive right now. So if you see a lab range for LDL that says 0 to 99, zero cholesterol is not a good thing. What we really want to pay attention to with cholesterol is what is the ratio of HDL to LDL. Now, a lot of labs will actually list a ratio on your blood work. Some of them you have to pay extra for that calculation. It's not difficult to do. You can actually calculate your own cholesterol ratio by dividing your total cholesterol by your HDL. Ideally, you want to have a cholesterol ratio of a 3.0 or below. Most labs will tell you that a ratio of below 5 is normal. What's funny about that is then they'll list your LDL as being too high, but your ratio as being normal. So we never want to use lab reference ranges when we're evaluating a patient. It takes a real critical thinker and someone who knows what cholesterol does to manage that condition for most people. So why do we end up with elevations in LDL cholesterol? Well, LDL cholesterol is reparative. So if there's a process in our body that is causing damage, our liver is going to produce more LDL cholesterol to mitigate that damage. The reason we care about ratio between LDL and HDL is because HDL is actually responsible for clearing LDL away. Here's an analogy that I like to use with my patients. If you imagine you have a crack in a wall, you're going to spackle over it, and then you're going to sand it down and paint it. Right? Well, LDL does the same thing to the inside of your arteries. We get these little micro tears on the inside of our arterial walls due to blood pressure changes, inflammatory damage, etc. LDL gets snagged on that damage. So the wall is damaged and LDL is just kind of hanging out in circulation. It gets snagged on that little piece of artery and it will start to build up and spackle against that arterial wall. HDL is kind of like the sander. It comes along, sands down that plaque, and carries the rest of the LDL back to your liver to be recycled. As long as you have enough HDL to oppose your LDL, which means you have a ratio of 3.0 or below, you're in good shape. Now, something that's really interesting that not a whole lot of people or doctors know about is it's actually not good to have too much HDL either. You don't want an inverse ratio. If you have a higher HDL than LDL, you are at the same cardiovascular risk as you would be if you had too high of an LDL cholesterol number. Having an inverse ratio of HDL to LDL, which means that your HDL is higher, is actually an indication of chronic inflammation. And oftentimes we see this in our autoimmune patients. Now, we do want to have enough HDL. And what is enough? Well, we want to see an HDL of at least above a 60. HDL is way more potent than LDL. So if we see even a couple of points increase in an HDL value, not so much a decrease in LDL, we can get that ratio pretty close to a 3.0 or lower. Increasing HDL is not as straightforward as decreasing LDL. And oftentimes when you take a statin medication, it will decrease both of those values. This ends up leaving you in the exact same cardiovascular risk category. So statins are a total scam. Statins don't address the root cause of why an LDL cholesterol would be elevated. Instead, they just suppress it. That leaves you at an incredible risk because now we've done nothing to address the root cause of inflammation, and we've taken away your body's only natural reparative mechanism to repair that damage on the inside of your arteries. Poor diet, chronic stress, and lack of exercise are just some basic reasons why we end up in an imbalance between our HDL and LDL. So if statins don't work, if they actually increase our cardiovascular risk, what are we supposed to do about an off ratio? How do we increase HDL and decrease LDL and make sure that our ratio is within a safe range? This takes a nuanced approach, and it's not the same for every person. If you're curious about your cholesterol numbers and you want to take control of your health and be able to advocate for yourself, I've got something for you. Download my free guide to understanding cholesterol and ways to reduce inflammation. It's packed with actionable tips to help you get your health and your energy back on track. Click the link below or in the description. So now let's talk about the cholesterol income connection, because not all doctors and not all services are created equal, unfortunately. Physicians within insurance networks have to be able to prove dis-ease to your insurance company before they're allowed to treat you for it. It actually leaves them at a pretty large liability risk if they're treating you for something outside of a lab reference range. This brings up a lot of conflicting evidence when it comes to reference ranges and their relationship to insurance companies. I have seen reference ranges change on blood work depending on the value that comes back. So in other words, I've seen patients where they have a higher value of LDL cholesterol, and so the lab reference range has been altered by the lab to make that within range. There's a lot of implications there, right? Doctors have to know what a lab reference range is and isn't, and they need to know what a functional range and a healthy range is. Unfortunately, their hands are kind of tied. They can't treat you for something that isn't outside of a lab reference range, so their recommendations often end up being, here is a statin because we know we can get that covered by insurance. Since most medical schools are actually funded by pharmaceutical companies, doctors just aren't given the knowledge they need to help you to reduce your cholesterol naturally. I'm not sure if you know this, but traditional MDs are actually not required to take any nutrition courses as a part of their schooling. It's an elective, it's a choice, and at that they only get about 1 semester of nutrition training. So the model just isn't designed to help you to reduce your cholesterol naturally. Most of the time, they're just told, take this medication for this condition. So what does this have to do with income? Why would that be dependent on whether you receive the care that you need? Patients who can afford to pay out of pocket for doctors are going to have more luck getting a natural treatment option and having well-rounded holistic care than someone who has to stay within a state's insurance network. The other issue here is access to healthy food and the ability to pay for it. 80% of cholesterol actually comes from sugar and carbohydrates, not fat. So there's also a lot of misinformation out there about where cholesterol even comes from. In the 90s, there was a big push for low fat and non-fat foods because we all thought that that's what was contributing to our cholesterol. We started opting for things like seed oils and fake butters, and here we are with more oxidative damage in our arteries than ever before. These are the foods that are often available with things like food stamps. Buying a salad from a fast food restaurant nowadays can cost you twice as much as a burger. So here you are, you're in your doctor's office, they're telling you that you have high cholesterol and here is your statin, but you've made no changes at all to your diet because maybe you can't afford to. The risk there, again, is that now we've taken away your body's only natural ability to repair itself when you're eating poorly. and we've reduced your cholesterol to a point where you don't have enough anti-inflammatory steroid hormones either to help to mitigate that damage. If lower is considered better on cholesterol labs and your physician doesn't know anything different, you're kind of stuck. But it's okay. That's what I'm here for. Now let's talk about what happens when you have too much sugar and not all of it can get converted to cholesterol. It will actually get converted into little fatty acid chains called triglycerides. If your triglycerides are more than half of your total cholesterol, and if your HDL is below 60, the chances are you have something called insulin resistance. Insulin resistance leads to weight gain because in order to find a place to store these fatty acids, these little triglycerides, our body has to create adipose tissue. It has to create fat. When our body creates fat just to store triglycerides, it can lead to something called estrogen dominance because estrogen is also stored in fat. That's why a lot of people who have insulin resistance also have estrogen dominance. Fasting can help tremendously with this, but we can't engage in long-term fasting until we know that we have a functioning liver. When you break down fat, you release toxins and hormones. You need to make sure that you're taking some kind of supplement to bind onto those fat-soluble and water-soluble toxins and something to help to flush those liver detoxification pathways so that you don't end up with more problems than you had before. High cholesterol and insulin resistance are reversible, as is type 2 diabetes. Very rarely are these things that you need to be on a medication for, but this requires a lot of work on your part. It's that old adage, you can lead a horse to water, but you can't make him drink. I say that to my patients really often. I can give you all of the tools that you need to reverse these conditions, but ultimately it's up to you to make the diet and lifestyle changes. And just a note, swapping out your sugars for sugar alcohols like erythritol or xylitol isn't good either. We have a lot of research coming out now that those sugar alcohols have been a part of our foods for long enough, we can see that their downstream effects are actually just as damaging as regular sugar. They're still causing diabetes, they're still causing cardiovascular disease and stroke. If you're looking for a sugar substitute that has no effect on blood sugar, opt for a plant-based sweetener like stevia or monk fruit, but be careful because a lot of times they are mixed with sugar alcohols. You want to make sure that you get a pure form, and it's going to be pretty hard to find that in a store. It's something that you'll want to do your research and read labels for. Now, if you want to learn more about how sugar impacts your health, you're going to want to watch my next video. We'll go through the ways that sugar causes inflammation and how dysregulation in sugar levels in your body can actually affect your adrenal function as well. I will help provide practical tips for how to cut sugar out of your diet, even if you're on a budget. Click the video that's on your screen right now, and I'll see you there.